My name is Dr. Donovan, and if you're preparing for a caesarean section or C-section, or you've been told that you might need one, this video will walk you through what to expect. A caesarean is an operation where a baby is delivered through a cut in the abdomen and womb. It is a very common but major surgical procedure, and whilst it's generally very safe, it does involve some recovery time and potential risks. So in this video, we're going to cover when and why caesareans are done, how to prepare, what happens during the operation, recovery in hospital and at home, the risks, and what this means for future pregnancies. As ever, each section of this video is time-stamped and split into chapters to help you navigate your way around. So let's start with why a C-section might be recommended. Well, a caesarean may be planned in advance. This is known as an elective caesarean section, or it might be carried out as an emergency if unexpected complications arise during labour. You might be offered a planned caesarean or the elective caesarean if your baby is in the breech position, meaning that its feet or bottom are facing down instead of the head, and attempts to turn them haven't worked. You might also be offered it if you have a condition called placenta previa, where the placenta is covering the cervix, meaning that the baby's going to struggle to get out because the placenta is blocking that exit pathway. You're carrying more than one baby and a vaginal delivery isn't advised. You have preeclampsia, HIV, or late-stage herpes infection, or if you've had previous uterine surgery or a complicated caesarean before, or if you've had a previous vaginal birth which has resulted in a tear or an episiotomy scar, and the reason for this is that the tear can potentially weaken the muscles of your anus, meaning that if a tear was to happen again in a subsequent delivery, the risk of incontinence later on in life could be increased. Now on this particular point, if this applies to you, you should make sure you speak to your care team during your early pregnancy appointments to discuss potential referral to anal physiology testing, where the integrity and strength of the muscle can be assessed, which can help you make a more informed decision about whether or not a caesarean section might be advisable and right for you. Now, a non-medical or maternal request for caesarean can also be made. Now, if you're feeling anxious about vaginal birth or have specific reasons, your care team should offer you a full discussion, including counselling and, if needed, the opportunity for a planned C-section if, after support, that still feels like the right decision for you. Now, on the other hand, an emergency caesarean might be needed if labour is not progressing, there is significant bleeding, the baby's heart rate shows signs of distress, or other complications arise requiring urgent delivery of the baby. And this is really for the health of the baby. So now let's take a look at what happens before the operation. Well, if your C-section is scheduled, you'll usually attend a pre-operative assessment within a week of your procedure. At this appointment, your medical history will be reviewed. Blood tests will check for anemia as well as your specific blood group. You'll be given medications to take on the day, including antibiotics to reduce infection risk and tablets to lower stomach acid if needed, and you'll have the chance to ask questions and sign a consent form. This is a form that states you understand what the procedure involves and any potential risks. Now, I would like to emphasise that you should always feel comfortable and confident to ask your obstetric team about anything you're unsure or uncertain about, and that really no question is too small or silly to ask. So please don't be afraid to ask whatever questions you need to ask to make you feel comfortable. Ultimately, you need to feel as comfortable and confident as possible before undergoing what is a major procedure. Now, you'll be asked to fast for several hours before surgery, meaning usually no food for at least 6 hours and no clear fluids for 2 hours beforehand. So what happens on the day of surgery? Well, when you arrive, you'll change into a hospital gown. It's possible that a small area of pubic hair may be trimmed. A catheter, which is a thin flexible tube, will be placed in your bladder to keep it empty, and you'll be taken to theatre for your anaesthetic. Now, the vast majority of caesarean sections are done using either a spinal anaesthetic, which is a single injection into your lower back that numbs up the lower half of your body, or an epidural. A small tube is placed into your back for continuous anaesthesia. This means that you'll be awake for the birth and your partner can be with you. You'll feel some pressure and movement, but no pain. And if you do feel any pain at all, you must let the team know. Now, in some cases, especially if the baby needs to be delivered quickly, a general anaesthetic is used. This means that you'll be asleep during the operation. So now let's talk through the operation itself. Well, you'll lie down on an operating table, tilted slightly to the side to improve blood flow. A sterile screen is placed across your chest so you won't see the surgical field. However, you'll be able to hear what is going on and the team will keep you informed throughout. And if you want to, you can have a playlist of music playing in the background if this makes you feel more comfortable, and I would recommend this. So here's what happens. A horizontal incision is made just above your pubic hairline, often called a bikini line incision. The surgeon then carefully cuts through layers of skin, fat and muscle to reach the womb. Once the womb is opened, your baby is delivered, usually in the first 10 minutes. You might feel some gentle pressure, pulling or gentle tugging, and this is completely normal. If your baby is well, they'll be lifted up for you to see and passed over to you or your partner for skin-to-skin contact, and if possible I would advise you do this. It's really good for you and the baby. After the birth, you'll be given an injection of oxytocin to help your womb contract and reduce bleeding. The womb and abdominal layers are then closed, usually with dissolvable stitches. The external skin may be closed with dissolvable stitches or with staples that will be removed within a week. Now the full procedure will vary depending on time, but typically around 40 to 50 minutes. Now let's look at recovery, first in hospital and then at home. So after the operation, you'll be moved to a recovery area. For the first few hours, your blood pressure, oxygen levels and bleeding will be monitored. You'll be offered pain relief regularly. If you're not, please just ask for it. And you'll be encouraged to start breastfeeding or have skin-to-skin contact with your baby if you wish to do so. The catheter, which is the tube in your bladder that's letting urine drain, usually stays in for 12 to 18 hours until you're able to get up and walk. Most people go home within 1 to 2 days, depending on how they're feeling and whether there are any complications. So now let's talk about recovery at home. Well, you'll need to take a few things slowly over the next few weeks. You'll likely have some soreness around your tummy. Remember, this is a major abdominal surgery. Painkillers like paracetamol or ibuprofen are usually fine if you're breastfeeding. Now you might have some vaginal bleeding. This is normal and may last for several weeks. Use pads but not tampons to reduce infection risk. Your scar will be just below your bikini line and should fade over time, but it can take up to 6 months to a year to fade properly. Now you should avoid lifting anything heavier than your baby, driving until you can do an emergency stop safely. Usually this is after 4 to 6 weeks. Exercise, sex and strenuous activity should be avoided until your body feels ready. And in the UK, your midwife will check your wound and remove any non-dissolvable stitches if needed, usually around 5 to 7 days post-operatively. You'll typically also have a 6-week post-natal check with your GP or family medicine doctor. So now let's cover the possible risks and complications. Well, like I mentioned earlier in this video, C-sections are very safe overall, but as with any surgery, there are potential risks. For the birthing parent, these might include infection of the wound or womb, excessive bleeding or the need for a blood transfusion, blood clots in the legs or lungs, or injury to nearby structures like the bladder or bowel, although this is rare. Again, you should speak to the operating team about all of these risks to make sure that you're aware of them and that you're comfortable with going ahead with the procedure. Now for the baby, the most common risks include temporary breathing difficulties, especially if born before 39 weeks, a small accidental cut during the operation, which usually heals well. Now you'll be given antibiotics and blood thinning treatments after surgery to reduce the risk of infection and clots. And finally, what does this mean for future pregnancies if you have a C-section? Well, having a caesarean now doesn't automatically mean that you'll need one next time if you choose to have another baby. Most people who've had one caesarean can go on to have a vaginal birth after caesarean or VBAC with appropriate monitoring during labour. However, another caesarean may be recommended in some cases depending on the reason for your first one or the overall risks. Again, this is going to be an individual decision that you should take with the team that is caring from you. Now, having multiple caesareans slightly increases the risk of issues like where the placenta attaches too deeply or potential scar rupture, but these are also still relatively rare. If you found this video helpful, please let me know in the comments section, and if you've had a caesarean yourself and want to share your experience, please also do so in the comments section of this video, because I'm sure it will help many other women who are about to undergo this procedure. For more information on caesarean sections, including lots more detailed information, please check out the description box of this video to lots of trusted evidence-based resources. I wish you the very best for pregnancy, your delivery. Please enjoy this special time with your baby. Thanks for watching and take care.